Hello, everyone, and welcome back to the Mind Body Medicine for Chronic Pain podcast. My name is Sean Hershey. I am your host, and I am a psychotherapist. I specialize in helping people heal from chronic pain using psychological and emotional modalities. As I always say, most people don't even know that's possible, but it is. All right, we're going to do a very brief intro today because we've got an awesome interview guest. Dr. Jennifer Franklin is a true expert in treating IBS. She has a ton of good information. And it's not just IBS, it's all disorders of the gut-brain interaction. So without further ado, we're just going to get straight into it because this is a good one. There's a lot of good information and I don't want you to miss any of it. Let's talk. Hello, everyone, and welcome back to the Mind Body Medicine for Chronic Pain podcast. I am here today with a wonderful guest, Dr. Jennifer Franklin. Welcome, Dr. Jennifer Franklin.
Thank you. Thanks for having me on your podcast.
Absolutely. So glad to have you here. So why don't we start with why don't you just start by introducing yourself? Tell us about your what you do professionally, and then we will go from there.
Okay. I am a psychologist and I've been in practice for over 20 years. And pretty much from the beginning, I started specializing in treating IBS. I was one of probably maybe a handful of psychologists specializing in that or specializing in the area of GI. So I was one of the first, gastro-psychologists, as they're called now, or GI psychologists. And so that was interesting being sort of one of the first, and not a lot of people kind of worked in isolation because a lot of physicians didn't really understand what I was doing, and a lot of psychologists didn't understand what I was doing. And so it was interesting. Um,
Mhm. Right.
yeah. But then from there, I started, right away, I was working in Los Angeles, which is where I'm from. And I had friends who were physicians or, friends with friends having weird symptoms that had been medically checked out, and there was no medical or physiological cause for the symptoms. And so I would get these phone calls every so often, like, well, I have a friend, or I know somebody with these kinds of symptoms, or I have a patient with these kinds of symptoms, and can you help them? So from IBS, it became sort of more general, right? I started seeing people with all kinds of mind body or neuroplastic symptoms. And then I moved to North Carolina, which is where I am now. And I had an opportunity to work at a premier clinic for GI. And that's where I really learned a lot about how physicians were thinking about things. And they were specializing in what are now called disorders of gut brain interaction. And so I was seeing the gamut of cases, almost exclusively DGBI cases, like irritable bowel syndrome, chronic constipation, chronic dyspepsia, cyclic vomiting syndrome, and there are a few others too.
Awesome. Yeah, well, and I mean, people who listen to this podcast know that IBS, when I was in my 20s, and early 30s, IBS was like bad symptom for me. And at that time, I don't, I think I'm sure I would have been aware
Hmm.
if the term
Hmm.
DGBI was used, sort of in common medical
Hmm.
conversation, which was not at the time. So I'm curious about that. I mean, talk to us about it sounds like you've been like there through all these different mindset shifts. Talk about the emergence of that term. Like what do you know about the history of the term
Well,
DGBI?
what we're calling mind body symptoms in medicine have long been referred to as functional medical disorders or functional medical symptoms. Every medical specialty has its diagnostics or diagnoses that fall into a functional medical category. And still, I think a lot of doctors still refer to functional medical problems as such. So the GI category of functional medical symptoms used to be called functional gastrointestinal disorders, or FGIDs.
Mm.
And there was a move recently, I'd say in the last 5 years, to transition from that term to the term disorders of gut-brain interaction, because that describes a little bit better what's actually happening, right? That there is some weird communication going on between the brain and the gut that creates these symptoms and perpetuates these symptoms.
It's so great to hear about that change in the field because it very clearly brings patients closer to an actual solution. Like bringing the brain in to the understanding of the diagnosis so clearly brings the patient closer to an actual solution. So it's awesome to hear about that. I was diagnosed with a functional bowel
Hmm.
disorder at like 28 or something. And then there was like sort of nothing to do about it. The doctor was like, well, that's it, functional bowel disorder, okay, bye. It was so unhelpful, you
Yeah,
know?
that's unfortunate. It makes me sad when I hear these kinds of stories, because I think the care can be so much better. I think it is so much better. I had better care than that, 30 whatever years ago, when I was a teenager and I was diagnosed with IBS. So it's just like sad.
Yeah. No, yeah, but, I mean, I can sort of laugh about it now because now, I don't have chronic IBS anymore,
Mm,
but at the time, it was devastating, like,
yeah.
that was it. I mean, to have my stomach hurting all day, every day, no solution,
Yeah.
like, it was devastating.
Yeah.
Let's transition to talking a little bit about your experience coming into this field.
Mm.
I mean, you're talking about being diagnosed with IBS yourself. Were you interested in being a psychologist focusing on gut issues because of your own personal experience? Like, talk to us about like how you got into this.
Okay. I mean, it's a long story. I didn't have a guide
Yeah,
to help me along. So my full recovery from IBS was largely self-directed. Um,
yeah,
and so it took a long time as a result. I'd say it was about 10
yeah.
years start to finish,
Wow,
of
wow.
gradually getting better,
Hmm.
to the point that I had 0 symptoms and started unraveling, the sort of fear avoidance behaviors that one starts engaging in order to manage symptoms. So, when
Right.
I stopped having symptoms, at some point, it was like, "Why am I still avoiding these things?"
Mm.
And that's when so it was around it actually so the quick and dirty is, I got into working with IBS, which is again how I started. Um, when I think I was still in graduate school, I was writing my dissertation, and I was working as a psych assistant for a psychologist in Los Angeles, and I was responsible for getting my own clients. And I was also simultaneously working part time to make ends meet as an accountant, because that was my undergraduate
Mm.
degree, actually. And I was working for some different firms, like an advertising agency and a marketing firm. And so I was
Mm.
kind of building my caseload and picking their brain about how to get new clients in the door. And they all said the same thing: you need a niche. So I started thinking
Yeah.
about how to create a niche for myself. And one day I had a conversation with my mom, and she said, you should really work with people with IBS because of, you've recovered.
Hmm. Hmm.
And my first reaction was, oh no, no way do I want to work with IBS patients. And the
Mm.
reason why is because I was scared that if I was to sit in a room and hear their stories, that somehow that would activate my own symptoms, which at that point was so irrational. I mean, maybe at any point it's irrational, frankly, um, but it was like the final. piece that I had to resolve because and I resolved it in, like, days. As soon as I started having that reaction, I started asking myself, "Wow, what's that about? That's really
Yeah.
interesting that you think that." And as
Uh-huh.
soon as I acknowledged how irrational it was, that was it. Then I thought, "You know, that's a really good idea. I know how to do this because I've just done it myself." And how many, there's so many people out there suffering, and who are they working with? Seriously. Um,
Right, right.
so that's how it started.
That's amazing to hear. It's so nice. Sometimes, I mean, it's like our own experience is such a profound teacher. And of course, you learn so much as a psychologist. You learn so much in school. You literally have a doctoral degree. Um, and you have all those skills and you have your personal experience, and it's just and I just totally relate to that. It's nice to be able to offer that to the clients that we see now, that we can offer like both our professional education and and our personal experience, and every therapist has that in some way, but it's not everybody who sort of goes out on a limb and really shares, that they have had personal struggles. And what a great story, and how hopeful that you have recovered from
Thank
that.
you. Thank you. It was many years ago now, but I think one thing that's important for me to say is that, when you live with IBS or some other DGBI, it is it's solitary. It's
Yeah.
very solitary. I think it's a lot easier and a lot less taboo to talk about chronic pain. But when you have digestive problems, nobody really wants to hear about that. These days, I think talking about poop is far more taboo than even talking about, the usual taboo topics like sex and religion,
Yes.
or I guess today it's
True.
politics.
Right. Right.
So, um, I think it's really lonely to live with a DGBI. And so for that reason, it felt important to come out and talk about, my own experience with it, just to let people know that they're really not alone, that I really get it. And I think it's extremely empowering and hopeful to hear that I fully recovered.
Yeah. It's really powerful that you say that. It's making me think, when I was in the worst of my IBS days many years ago, I I grew up like, in the environment of like, don't talk about bodies, don't talk about bodily functions,
Mhm.
which is how most people grow up.
Mhm.
I think I may have grown up with a little more kind of extreme negative conditioning around that, but most people, I mean, that's very common to grow up that way. Like, certainly don't talk about poop.
Right.
Like, that's
Yeah.
ridiculous. And it's funny how sometimes the symptoms, I mean, different people have different theories on this, but like sometimes the symptoms really are pushing you in the direction you need to grow personally. And having the symptoms I had to talk to people about like farting and gas and pooping
Mm.
and diarrhea
Mm.
and constipation. And so I
Mm.
actually had to open up to people, friends, doctors, family members, about things that would have been so shameful, but I kind of had no other choice. And it's just interesting, I wonder if on some level my body was pushing me to, it's like, you gotta talk about me,
Yeah,
and
I
if
mean,
this
I
is
I
what it
I I
takes.
don't think it's a coincidence. I think that's a stressor. Having to hold everything in is very stressful for your brain and body. We need to talk. And some people need to talk about certain things more than others. And so it's not a coincidence. It's the very reason, it's part of the reason why you have the symptoms in the first place is that there are stressors in play that result from our habits. And
Yeah,
in order to resolve the symptoms, we have to create new habits.
yeah, absolutely. Yeah, 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 yeah. Wow. Um, So okay, now this is, you've done this professionally for many years. You have a ton of experience. A lot of people who listen to my podcast are in different places and have different, different mind body symptom presentations.
Mhm.
But certainly there's a lot of people listening who have IBS or who have
Mhm.
DGBIs. Um, so people are at, different places around like, I know that my brain is involved in
Mhm.
this. I know this is, TMS or a mind body
Mhm.
condition or a neuroplastic condition, whatever you want to call it,
Mhm.
all synonyms for the same thing. Some people know that. Some people are still on the verge questioning that. So why don't we start there? Um, what advice do you have? And this is not for every single person listening to the podcast, but this really applies very specifically to some people. What advice do you have for like somebody who has a DGBI and isn't sure like what is it? What's causing it?
Okay. So, I mean, this is where I begin with most of my patients that come to see me. So this is a great question. The reason why we don't understand how to fix the problem is because we don't have an answer to that right away, right? And that's really frustrating for people, right? And so the way most of us try to solve life's problems is we think about them. We try to assess the problem, diagnose the problem, figure out what is going on, why is this happening? And then from there, we understand how to fix it, right? But the more that we think, you know, logically, rationally, reasonably, the more that we use logic to solve our IBS or DGBI problem, or frankly, our chronic stress problem, whatever the neuroplastic or mind body condition is, the more we think about it cognitively with our thinking brain, it just becomes sort of frustrating. And at some point, it becomes like banging your head against the wall. You just don't get anywhere new. So you can think, and you keep expecting that you're going to come up with something. And it's like the quest for the Holy Grail.
Mhm.
So it's just not helpful. So we kind of have to be willing to stop the search and, stop being a seeker of that kind of answer and come at it from a different, come at it a different way. Right, and I have
Yeah,
if I can make a joke really fast. So the name of my
please.
private practice when I first opened, was Open Door Therapy. I still have the name, but my, my my specialty area is now, um, don'thateyourguts.com, right? So that's where all of this stuff on GI conditions and, mind body stuff lives. And in the process of getting business cards and getting a logo created for Open Door Therapy, my friend who was the graphic designer who did it, he would joke with me and say, you really should call your practice backdoor therapy. I know.
That's
I
amazing.
know. It's so funny. But here's the thing. He was onto something. I don't think he
Yeah.
realized it, but, it's a double entendre because the truth is that we have to take a backdoor approach to solving these kinds of problems because the front door, the way we normally think about it, does not work. It just doesn't.
Yes.
Okay,
Yes.
so what do we do? Well, first of all, we have to just accept that we don't cognitively understand exactly why the problem is happening to me, to you, to the specific person. We know generally, right? We know stress is a
Mhm.
big factor. We know diet has a role. Um, I mean, those are the two sort of main factors as long as you're diagnosed with a DGBI, right? Because doctors have already ruled out other things.
Mhm.
And so can you accept not knowing? I mean, that's step one. Can you accept that you don't have the answer right now? And if you keep searching, you're actually creating more stress, which is adding fuel to the fire and making the problem worse. So can you let go of needing to understand exactly why it's happening to you at this time?
Mhm.
Right.
Yeah.
And can you kind of hang your hat on what we do know? Like, let's start with what we do know. I think that's really important to let go of needing to understand something we don't know and to focus on what we do know, right?
Mhm.
We know that you have a diagnosis with this problem. We know, that chronic stress is a big factor. We know that stress affects the gut, we have all of this information, so we can deduce that chronic stress is probably a big factor in your
Mhm.
symptoms. So with that, can you accept that that is probably what's going on,
Mhm.
right? And then if you really accept that, there's an easing that tends to happen, right?
Mhm.
And from there, so here's the deal. The more calm and ease that we can generate inside, the less stressed we are, right?
Right.
The more calm and ease we have inside, the better our brain can think, right? The more mindfully our brain can process information and understand things, right? So that means that we can see more of the picture when we have capacity for mindfulness. And when all of those functions get turned on because we're turning on the parasympathetic nervous system, which is what we want to do in order to reduce stress and to turn things around and to help reduce the GI symptoms. So, the more that we turn on the parasympathetic nervous system, then the more mindful we can, the more capacity for mindfulness we have. And as that happens, there becomes more space and time because we're more settled. We're not in crisis mode, right? So
Yeah.
suddenly things start to bubble up to the surface,
Yeah.
right? We can maybe start to remember certain things. Like, I mean, I think a great example of this, a really trite example of this, is when you're trying to remember a word,
Yeah.
right? And
Yeah.
it's like, the more pressure you put yourself, like, "Oh, what is it? What is it? I need to know what it
Right.
is." The more you pressure yourself to come up with that word exactly then, usually the worse it goes, right? The harder it is for your brain to actually access that information because it becomes so stressful. It just doesn't work very well. But guess what happens? When you let it go and you go, whatever, it'll come when it comes, then
Mhm.
it comes.
Mhm. Yes. Yeah, yes, from personal experience and from working with clients, yes. Let go and stuff will come up. I'm curious, like, as you're talking about, like, as you let go and as you relax, that allows for things to bubble up to the surface.
Mhm.
What kinds of things do you typically see, just so the audience, like, has a sense?
Okay.
What kinds of things do you typically see as, like, the things that need to bubble up to the
Oh,
surface for
everything.
Great.
It
Yeah.
happens in steps. So step 1 is, step 1 for me in working with somebody is always how quickly can we shift into a calmer state of being just in the moment. So like, right now, whatever you're experiencing, right? Can you can you focus your attention on something that helps you to feel good or better or calmer? It could be anything. It could be a really wonderful memory. It could be something really lovely that you see outside. Just any stimulus that triggers a shift towards more rest and digest, more parasympathetic, right? A more
Mhm.
parasympathetic state. And that's very, I don't want to say it's very individual. I mean, there's some common things, but for some people, what they're really needing or missing, whether they realize it or not, is, more time out in nature or, just quiet, more quiet. Right. And so
Mhm.
when they come in my office, I have these ways of, these exercises that I take people through without them even realizing necessarily that it's an exercise. But just organically,
Mhm.
I'm tracking what's happening and I'm on them as soon as I notice that there's a shift, even the tiniest little shift towards more calm, more ease, more goodness, more settling, anything that feels better, right? So we can see that with a smile on the face, we can see that with a deeper breath or a sigh or them reporting that, oh, that feels nice or good. Those are often words that get used. And
Mhm.
so then it's a matter of capitalizing on that. Okay, like, oh, great. Like, let's really be with that. Let's see what happens. And usually what happens is there is some kind of self-reflective statement that comes out like, oh, this feels really nice. Can't remember the last time I was here. I wish I could have this all the time. So right there, it's like they're telling me the missing experience, or it's probably not just one missing experience. There's probably a number of missing experiences. Missing equals opportunity for corrective experience,
Mm,
right?
mm, mm,
So if we can help people to have what they've been missing, even the
mhm,
tiniest little bit, right? And then if we can help them cultivate a quality of attention, I like to call that, a mindful state or, a mindful state of awareness or whatever you want to call it. But if we can get people to be very present while they're doing that thing or while I'm helping them to experience that missing thing, they will have a corrective experience. And then they'll be able to talk about that. And that usually connects to memories, that connects to old habits, there's stories there. There's all kinds of material for us to explore about, you know, you know, when did that missing experience start? Did it start because of some kind of traumatic or stressful experience that changed the trajectory of your life in some way? Or,
mhm.
have you been depriving yourself? Do you not seek these experiences? Do you not let yourself have these experiences? Do you not do you not know how to be present enough to actually fully experience this and to allow your body to shift from a state of greater stress to a state of greater rest and digest?
Yeah, yeah, no, beautifully said. I mean, it's making me think it's so beautiful the way the body guides you to what you need, because I'm just thinking about the example I just shared, when I had severe chronic IBS, and the way that I'm even identifying now, like, I needed to be able to talk about what was really going on for me,
Right,
like, authentically for me
right,
and for my body.
right.
Um, the symptoms led me in that
Yeah,
direction for sure.
yeah,
I mean, I really relate to what you're saying
yeah.
about, like,
Yeah.
yeah,
So you're saying that was a missing experience for you, and it was hugely corrective for you to take the leap of faith and to take the risk, right? To start opening up and sharing and trusting that whoever was there was going to receive that well and be tenderhearted towards you,
right,
right? And to receive it
right.
with care and to maybe validate.
Right. Right, right, and I mean, yeah, and it's and this is the same, the experience that I have with my clients. It's like, it takes you right into the important pieces, like listening to the body, because right there, what you're saying is like that was exactly a missing experience for me in my childhood,
Yeah.
that sharing about me
Yeah.
was not received with tenderness.
Right.
So it's like, and there's a lot to work with there. So the
Right.
body takes you right there.
Right.
Let me ask you, I mean, you mentioned diet,
Mhm.
and so let's wade into that, because some of these things are controversial, where it's like, some people are like, Eat whatever you want. It's all brain based." And then of course there's the, like, non-neuroplasticity informed people who are like, the reason you have this problem is because you're gluten intolerant or because you're dairy intolerant or whatever. I'm curious, like, given your very holistic understanding these disorders, talk to us a little bit about diet
Mhm.
in that framework.
Well, I'm a psychologist and not a dietitian or nutritionist. So it's really outside of my scope to talk about a specific diet that's appropriate for a person. So I just want to say that.
Sure.
But
Totally fair.
um, it's you can't talk about diet without recognizing that psychology plays a role in our digestive experience. Right? Because
Mhm.
if you believe that it's safe to eat something, then that food is going to get digested a lot better than a food that you don't totally trust, right? Because if you don't totally trust something, but you put it in your body, it's almost like a nocebo effect,
Yeah, right. Absolutely.
right? And so that's a factor. that affects people with DGBIs. And there are allergies. Do you have a confirmed allergy? Meaning that you've taken some tests that confirms it for you, a valid test by a physician. And or, I mean, the other reality is that if you eat something and every single time you eat it, you have the same reaction, right?
Mhm.
I think, that may indicate you should not be eating that thing. However, if you
Mhm.
can eat that thing sometimes, but then
Mhm.
you have a problem other times, I think that's a
Mhm.
little more sus,
Mhm. Agreed.
right?
Yes.
So, what's going on there? And how much time, attention, stress do you want to generate? It's like we always have to think about how to reduce stress. I mean, that's the end goal here is we know we need to reduce stress. And so
Mhm.
if you're getting really worked up about eating something, like really worked up, and you are not at a place where you can have a conversation with yourself and, kind of like I did, that I described having with myself about this irrational fear I had, like working with patients initially,
Mhm.
right? That if they
Mhm.
talk about their symptoms, I'm going to have, I recognize instantly how irrational that is. But,
Mhm.
if you feel that your thinking is rational, it makes sense that you get sick sometimes and you don't get sick from the food other times. If it makes sense to blame the food, and you're convinced that it's the food, I don't think there's anybody who's going to be able to talk you out of that. And
Yeah.
I'm not going to get
Right.
into an argument with you about that. I'll defer to your best judgment because this is your body and you know
Mhm.
yourself better, right?
Mhm.
But over time, if we really work on stress, the idea is, and I've seen this happen a lot, that the
Mhm.
reactivity to food goes down,
Yes.
right? And
Yes.
so if you start recognizing that you're just generally living with less stress, you're noticing it in a lot of different ways, then that might be a good time for you to eat those kinds of foods that are, you know, sometimes okay, sometimes not, right? And then there's a particular way to do it, right? Because if you're at all feeling nervous or stressed about eating a particular food that you believe can cause you problems, then you've got to be clear that it's like you have to be willing to talk yourself through a process of letting go of the fear, right? Because it's somewhat irrational, right?
Mhm.
Because
Yeah.
it's entirely possible for you to eat this food. And I think if you can, there's a lot of ways to do this. And, some work better for some people and some work better for others. But, I think it's very compelling to think about how many times you've eaten this food in recent times or even in the past and had it go well, right? Instead of
Mm.
focusing on
Mhm.
how many times it goes badly, right?
Mhm.
And if you start adding them up, especially the recent ones, and, more times than not, you have a good experience, that's compelling
Mhm.
evidence for you being able to eat this food,
Mhm.
right?
Yeah.
And then you've got to get yourself into a really calm state just
Mhm.
before you eat it. And then you've got to
Mhm.
stay in that calm state, right? So you've got to set up the conditions under which you're going to have a good digestive experience eating something that, you're not totally sure about.
Mhm. Yeah. Yeah, no, no, thank you for sharing all that. Absolutely makes sense to me. And I'll just share, this making me think of a personal experience I had. Um, when I had severe chronic IBS, one of the many things I did a few times I did, like, allergy testing where, they, like, prick you with
Mhm.
different, potential allergens. And, I had been eliminating gluten,
Mhm.
eliminating dairy, eliminating nightshades,
Mhm.
all sort of the heavy hitters. I've
Mhm.
been eliminating all that. When I got one of the tests I got, one of the allergy tests I got, it was like I had a little mild allergic reaction to many different
Mhm.
things. And then there was one thing that I had a severe quote unquote allergic reaction to, which was mustard seed. And I was like, yeah, I was like, I didn't even think of that. Mustard seed? Like I have not even been tracking or paying attention to like what does and doesn't have mustard seed in it. Do I eat mustard seed? I haven't even
Mhm.
been tracking that. So I was like, well, okay. If there's one thing that I know, I do need to not eat mustard seed. And so for a long time, so for a long time, I didn't eat mustard seed. Um, and slowly, as my gut symptoms started to improve over months and
Mhm.
years, I reintegrated mustard seed without really even thinking about
Hmm.
it, and it was totally fine. And I would say, I mean, now I don't have chronic
Yeah,
IBS anymore. So now, like, it wouldn't even occur to me to get an allergy test because I wonder. I mean, I wonder if I got an allergy test now, I wonder if mustard would still have, if my
right.
body would have a reaction to the little prick, if it wouldn't. But I don't, I'm like, I don't even
Yeah.
care because I know I don't need to follow
But
that.
isn't
But
that
what do you think about
interesting?
that? Well, yeah, yeah. Like, in what way? And like, what do you pull
Interesting
out of
that
that?
it tested positive, but yet you eat it without a problem today.
Yes. Yes.
And if you had the
Period.
test, I'd be very curious. You should call me if you have that test. I'd be really interested in hearing how it comes out today.
Maybe I should as like a stunt even for the podcast. Podcast listeners might wanna know. What one thing people can do actually in the podcast, in the show notes, there's um, click here to ask a question on the
Mhm.
podcast. If you want me to do the test again, I wonder if my insurance I have different insurance. I wonder if it even cover that. But okay, if you want me to do it again, message me, and if I get a couple messages, then I'll do it again,
Well, if it's
and
super
I'll let you know.
expensive, maybe you can crowdfund it if you had to.
Exactly. Exactly. Yeah, if you wanna send me your Venmo info through that same link, go ahead. But, okay, on a serious
Mm,
note, um, so you're already giving us, I think, great advice on, A, what to do if you're kind of on the fence, like, is this related to my brain, to my emotional life, to my psychology? Thank you. And B, we're already getting into, like, once you know
mm.
that, and once you have sort of settled into, like, "Yes, let me go through the proverbial back door because the front door is not working." Um, any, like, any other advice you have for people in that position who are they recognize, like, this is a mind-body condition. I'm still on the healing path. I have not the symptoms are still there. Advice you have for people who are in that space.
Yes. I think given everything that we've talked about today, I think it's important to thread back to the overarching um, approach, which is we want to move out of this state of chronic stress that you've been stuck in. We want to get out of that by turning on the parasympathetic nervous system or the rest and digest system as often as possible. And because the parasympathetic nervous system is a slow acting system, we have to stay in that more parasympathetic state for a good while in order to really reap the benefits. And what are the benefits? The parasympathetic nervous system, when it gets turned on, it helps us recover from the effects of stress. So that's why we have to spend time. That's why it's important to really immerse yourself in these kinds of pleasurable, calming, good, connected experience, yummy experiences that help us to really come out of that pattern of stress, that chronic stress that our brains and bodies have essentially gotten stuck in. And
Mhm,
that is a really important part of the treatment is just orienting towards engaging in the things that help us to feel good, help us to feel better. And that's really hard when you've been stuck in a state of chronic stress because the brain, in many ways, is hijacked by stress and doesn't function the way that it would if it weren't hijacked by stress. So we're likely to be reactive, right? And that reactivity causes us to just engage in the same old habitual behaviors again and again. So we maintain the chronic stress pattern,
yeah,
right?
yeah.
And so one of the things that I think is increasingly more important for people who struggle with DGBIs is learning how to slow down.
Mm.
And I say it's increasingly more important because our society, our culture is um, really compelling us to move faster, to think faster,
Yes.
to do more,
Yes.
to just push, push, push.
Yes. Let me just interject to say, I swear, every time I sit down to journal, the first thing that comes out is, I am so exhausted. I'm so done. I'm so overwhelmed. And I feel like my life is not that exhausting and overwhelming, but clearly it is. Or, well, I shouldn't say I feel like it. I obviously feel like it is. I think it shouldn't be. And yet it still is. So I just want to say, fully with you on this.
Well, it's really important. And it's getting harder for us to do this when the faster mode, right, being more sympathetically charged, is so heavily and constantly positively reinforced by, work environments, by society, by, and then, social media is,
Mm.
making it very enticing for us to, even consume, uh, consume information faster, right? I mean, I have to tell you, I have a YouTube channel. It's the Don't Hate Your Guts YouTube channel. And a couple of times, people have written comments about how slow my videos are. And because I'm
Mm.
talking, and I think it's important to help people to do the exact thing that they most need to do, which is to slow down. I mean, they need to do other things
Yeah.
too, but this is a very important part of recovery. So I have the opportunity in a video to actually help people in just talking at a nice slow pace to help them slow down a little bit. And it's an invitation without explicitly making it. And
Hmm.
it's so interesting how some people react to that because it's so hard for people. That's how hard it is for people to slow down, that they're
Yes.
essentially like criticizing me.
Right, right. Well, and let me just say, I know that people listen to podcasts sometimes on like 1.5 speed or
Yes.
2 point speed, and I have never, I don't do that, but I have thought, I wonder what my podcast sounds like on 1.5 speed or 2 speed,
Yeah.
2x
Yeah.
speed, and I'm like, oh man, I mean, I don't know, my word of advice to listeners of the podcast is, don't do that with the Mind Body podcast. Like consume it at the rate as it is
But
meant to be
but
consumed.
it's not about whether you do it or you don't do it. It's about recognizing the impulse, recognizing
Mm,
the
good point.
difficulty, the struggle that you have slowing down. And that is the question.
Yeah.
Are you slowing down? First of all, do you have the capacity to slow down when it's appropriate, when it's important for you to slow down? I.e.,
Yeah.
if you are having an emotional reaction to something, and it's not a 10 on the intensity scale, because a 10 is automatically going to bowl you over, and it's going to essentially make it so it's impossible for you to do anything else but to kind of be with that emotional experience. But we're talking a lower level emotional, reaction of some kind. Can you slow down and recognize that? Well, first of all, do you recognize it's happening? Are you slowed down enough to even track that? Right. And
Mhm.
if you're tracking that, what do you do with that? If you have the time and opportunity to engage with it and, you know, give it some time and attention to understand it and to validate it and to see if there's something else that wants to happen, then are you doing that? And if you're not, why not?
Mhm.
Right. If you have
Yeah.
an opportunity to, gosh, okay, so I've worked with some people. This is probably a lot of people who do this. I've worked with some people who are just constantly taking in stimulation. When they have free time, what they do in their free time is maybe exercise, but while they're exercising, they're listening to a podcast. They're listening to somebody talk about something. right?
Mhm.
Or they're listening to, upper kind of, music, right?
Mhm.
Um, and so, if you are constantly taking in stimulation, right? What do you think that's doing? Like, you don't have a
Right.
pause anywhere in there to actually just have there be silence or to hear what's happening inside of you,
Right.
right? And this is a lot of people that live this way. They
Oh, yeah, yeah. No, I'm relating to what you're
Yeah,
saying.
like,
Totally.
they really
Yes.
can't handle quiet or having that empty space, and that's an indication of sort of a habit of keeping your sympathetic nervous system aroused.
Yeah.
So, um, yeah, like coming back to keeping our sights on what we're trying to accomplish. The overarching goal is to get out of this state of chronic stress that our brains and bodies have been stuck in. And one of the important ways to do that is to focus on something that helps us to find calm and ease through feeling good, through feeling connected, through going out in nature, lots of ways to get there. But they all involve on some level slowing down because rest and digest, that's what it's about. It's about rest, slowing down
Mhm.
essentially. And,
Yeah.
and then resuming normal digestive functioning, right?
Yeah. Yeah.
Helping uh our digestive system to do what it needs to do, right?
Mhm.
Yeah. No, that is such important advice. Like, yes, that is such a I'm like, I'm taking this in. I know that like a lot of my clients have this exact issue, and I'm sure people listening are this is landing with
Yeah.
them because
Yeah.
this, yes,
Yeah.
yes.
Any any other pieces of advice for people struggling with IBS, with DGBIs that you would like to share?
Well, if you're working with a therapist, I think it's
Mm.
important that you are working with a therapist that's helping you to do the work that you most need to do. And
Great. Okay. Okay. Great.
Mhm.
Great. Because let me just say, I one of the things that for just for people listening, one of the things that Jennifer and I talked about was we wanted to talk about don't stick with a therapist who keeps you stuck. So give us a little bit of that as we're winding down.
So, okay. y- Therapists are trained in different ways, and different therapists, tend to gravitate towards different approaches. And then, people who come into therapy have different expectations about what that experience is like. And, if they've seen what therapy looks like on TV, let's say, or in film, they might have certain ideas about what to expect.
Mhm.
And, when you have a DGBI or chronic pain or some kind of mind body problem, you know, we're talking about how chronic stress is underlying the physiological symptoms and driving them. So we have to address that chronic stress issue, right? So, and we also talked today about how chronic stress, being stuck in a state of chronic stress is basically being stuck in sympathetic arousal, which is fight or flight,
Yeah.
right? Which keeps us reactive and less mindful and less capable of engaging in certain ways of thinking and being, right? It keeps us from being able to slow down and pause and be more present and all of that stuff, right? So if you're coming into therapy in that state of chronic stress, and this is probably most of my patients that come in the door and they're rearing to go. They come in, they've been to other doctors, they might have been to other therapists, and they come in and they're ready to get to work. And so, what does that look like? Well, they want to just tell me their story, right? And they want to tell me all the details and they want to tell it to me fast because faster equals better in most people's. We just talked about this. Faster equals
Mhm.
we can get to the end goal sooner if we move faster.
Mhm.
And I'm telling
Mhm.
you, it is actually quite the opposite. right? You have to do something that's very counterintuitive in order to help yourself to really feel better as quickly as possible. Because what you want to do is go faster. What you want to do is think more about the problem cognitively.
Yes.
And what needs
Mhm.
to happen is for you to stop all that and to pause and just allow yourself to be present with whatever you're experiencing in that moment, right? And if it's frustration, okay. So you can start there. Oh, I'm feeling frustrated. Okay. Now, some therapists take a much more supportive role. So they are less directive. So in other words, if somebody comes in like I just described, right? Anxious, because chronic stress equals anxiety, right? That's what it looks like
Mhm.
for
Right.
most
Right.
people. Anxiety of some sort, whether it's diagnosed or not. They are,
Mhm.
talking fast, thinking fast, moving fast because they're, stuck in sympathetic arousal. And if they're just going to kind of drive the session, right? And run their game, not that it is a game, but run their program, right? They're going to
Mhm.
do what they do because that's what we do. We do what we know how to do,
Mhm.
what we're trained and
Right.
programmed to do, what we've learned how to do really well. The things we've learned how to do really well become our habits, and that's what we do. And we bring that with
Right.
us wherever. So if
Mhm. Including into therapy.
including into
Yes.
therapy. And so then if you have a
Yes.
therapist that's just kind of a little more hands off and letting clients or patients sort of do what they do, you know,
Mhm.
that can be a disaster because
Mhm.
then a patient who really wants to feel better quicker is actually being enabled
Yeah.
to continue to do what they do, which is not working very well. Right? And
Yeah.
and in order to, promote, change, right? Okay, so I like this is a good way to think about it. This is something I tell a lot of my patients at some point in the process of working together. Therapy, like effective therapy is, we could say it's a function of a number of things, but I think it breaks down to 2 things, right? That are greatly facilitated by some other things. But
Mhm.
by and large, therapy works because we increase awareness, right?
Mhm.
And that's
Mhm.
step 1. And
Mhm.
some therapists, that's what they do. Their whole mission is to promote increasing awareness, and that's it. And then they kind of
Mhm.
leave part 2 to the client or patient, and part 2 is doing something different.
Yes, yes, yes,
If
totally,
we don't do
totally.
something
Yep,
different, nothing's gonna change. Nothing.
yep.
So you can be aware. I mean, you could say that becoming aware is the doing something different. I mean, it is doing something different in a way because you have to change your behavior to even create more awareness, right?
Yes, and I think you're so right that there is a second step, like,
Absolutely, there's
I
a
think you're
second
so right.
step.
Yeah. Right,
Absolutely
right.
100%. And especially for people who have, mind body conditions or DGBIs. I mean, it's essential. The behavioral intervention or behavioral change is just absolutely critical. That's what
Mhm.
that's what helped me to heal and recover. If I hadn't been willing to change my behavior and start tinkering and doing little things different and then other little things different and keep building and building and building, nothing would have changed really.
Mhm.
And
Mhm.
so the deal is that some therapists um, are really good at helping clients or patients to increase their awareness about what's happening, but are not directive enough to help their clients or patients to do something different. And even if they talk about, hey, you need to do this differently, and they talk about how to do it, chances are clients or patients are not going to do it outside of therapy. Why?
Mhm.
Because they don't have a habit of doing it. They don't have a habit.
Mhm.
And so, uh, you know, people can get really stuck and then they come back and they feel like, oh, I feel so ashamed. I didn't do what I was supposed to do over the last week. And then they'll keep troubleshooting and troubleshooting. But, in my experience, we have to help patients and clients to actually do the different thing with us in our
Mhm.
office as often as possible to start that habit going, to start
Mm.
that new habit. And then we can positively reinforce the behavior. And that's really
Mm.
important because positive reinforcement is how we learn.
Mm.
So
Mm.
if we leave it all up to them, I think that's really hard.
Mhm.
Yeah, and
Mhm. Yeah,
maybe
okay.
some people will start that and they'll be successful, but I think it takes a lot more self-discipline to do that,
Mm.
and if they hit roadblocks, they won't necessarily know how to articulate them and work through them. So, I'm not saying this is everybody, but there are
Mhm.
a number of people I think that would benefit from, uh, doing the change work in session.
Mhm. Yeah, I love that. Part 1, awareness. Part 2, you need to make some changes. I
Yeah,
I really respect
yeah.
that. Let me just illustrate this in case anybody listening is, I don't know, like wondering, like, what is, what does this mean? What I'm thinking is, like, going back to my previous example, having the awareness that, like, my body, when I had really bad IBS, that my body was one of the things my body was telling me was, like, I need to speak. I need to be, I need to let it out.
Mhm.
I need to be
Mhm.
myself. Like, if that's one of the things
Mhm.
my body is telling me, great. Having that awareness, making that connection, knowing that my body is telling me that, so important. And I think that this applies to people who are, maybe you don't have a therapist, maybe you're listening to this podcast, maybe you listen to a lot of podcasts, you journal, read the mind body books. You're developing a lot of insight about yourself and what you need and the connection between your body and your brain. Awesome. The second step is, like, if I were to know that and then do nothing with it, maybe that would be a little helpful, but how much more helpful is it to actually think, like, okay, what do I really need to share with people? What do I really want to share with people? What does my body need to get out? Like, what else can I do? And letting making that change in my life. I think a lot of people get freaked out by that because, people think, what if I have to get a divorce? What
Mm,
if I have to leave my
mm,
family? What if I
mm,
have
mm,
to leave my job?
mhm, mhm.
And I mean, I can just tell that's not what you're talking about. It's not what I'm talking about
Yeah.
either. Maybe some people need that, but I can tell what you're talking about are changes that are more subtle, and yet it is a change. I mean, what's your thinking about
Well,
that?
okay. First of all, becoming aware is the first step. And once we become aware of how we really feel about things or what is really generating stress, I mean, I could go on with a list of things, but those kinds of things. Once we become aware of what actually brings joy and goodness into our lives, um,
Mhm.
yes, it's important to see that clearly. And if we can see clearly what's going on and then we don't know how to change it, that is one of the most frustrating parts of the process of, psychotherapy or healing from,
Mm.
chronic pain or DGBI. It's like knowing what needs to happen, knowing
Mhm.
what's really driving some of the stress or all of the stress, but not yet
Mhm.
being able to fix it. That is a really frustrating, hard place to be. And it is a very normal part of the process of healing and
Mhm.
recovery because you can't change it unless you see it. Once you see it, you want to change it immediately and make it better. And you're
Yes.
not necessarily
Yes.
able to do that because you don't have the skills yet to be able to do that.
Yeah.
Right.
Yeah.
Or
Yeah.
or there's too much fear, right? Because
Mhm.
it's scary to make any kind of change on some level because it leads you into
Yeah.
unknown territory,
Yeah.
right? If you haven't been
Absolutely.
there before because you keep doing this other thing that takes you down a familiar path, then doing the new thing is unnerving, right? And for
Mhm.
some people are, extremely stressed by making certain changes or change in general, right?
Mhm.
And so we have to work with that. And big changes are a big deal. And I don't think they should be made easily or quickly when it comes to, again, w- if we're making reactive decisions, then perhaps that's indicative of you being under the guise or being influenced by sympathetic arousal. Maybe you're not in the most mindful state. Maybe you're not able to think really comprehensively about
Mhm.
what needs to happen in order to address whatever issue you're facing, right?
Yeah.
Um, you know, um, if you have a job that you believe is creating a tremendous amount of stress for you, um, maybe maybe you need to take a break because it's so highly arousing. But if you develop some new skills, maybe you could work in that job and just do it in a different way, right?
Yeah.
I mean,
Yeah.
there's so much that I could say on this topic because
Yeah. Yeah.
everybody's situation is a little bit different. And what
Mhm.
you need to do, we can't say like leave your job if it's really stressful. Um,
Mhm.
or leave your job if something traumatic happened. I don't know, what that traumatic situation is. Is it recoverable? Can you address it somehow? Is there
Mhm.
something to be done so it never happens again? Is that possible? Right?
Mhm.
Um,
Mhm.
yeah. It's just
Yeah, well, you're right. I'm just thinking this is why nuanced one-on-one work with a therapist, such as myself or Dr. Franklin, is so helpful. As we're winding down, where can people find you?
they can reach me through my website, don'thateyourguts.com, no apostrophe. And if they just want to watch some of my videos, they can go to the Don't Hate Your Guts YouTube channel.
Awesome. Great. And we will have that linked in the show notes below. So please check that out. And thank you so much for coming on the podcast today. It's truly been a pleasure. I'm sure people have really benefited from this. Any final thoughts before we're done?
I have lots more I could say about this, but I'll leave it at what I said. I think we covered some really great topics, and I think there is one more thing I want to say. I'm
Great.
not
Yeah.
saying that everybody needs to be working with a psychotherapist,
Sure.
but for
Yeah.
some
Right.
people, it's really important. For some people, it's essential.
Mhm.
And for other people, I think they can make a lot of progress by, um, you know, working on their own as long as they're not getting caught in some of the pitfalls, right? And some of these traps, or they're not banging their head against the wall for too long before they realize they've got to change course. And that's really what it's about, like to be flexible and to keep your eye on the ball, right? Like it's not about getting rid of the symptoms today. It's about dropping into a process, recognizing it is a process, and making choices that help you to feel more calm and ease in every moment that you possibly can. And if that means like slowing down now, even though you can't do it later, then, just being more aware of all of the choices you have in so many moments in your life. And you think you can't. You think, I can't possibly feel good right now.
Mm.
You might be able to feel good right now. You might be, and if not good, you might be able to feel better,
Yeah.
calmer, more at ease, more soothed. That's a shift. And it's important to recognize those tiny, tiny incremental shifts towards, better in the tiniest
Mhm.
ways, because that brings hope, right? It's like, oh, wait, if I can get there, cool, that's a little bit better. Oh, I feel better. I feel better. That's cool. That's hopeful.
Mhm. Mhm.
Okay, if I can
Mhm.
do that, I can do it again, right?
Mhm.
And then you just
Yep.
again and again and again and again and again throughout your day, throughout your week, throughout your month, throughout the year, and you will have accomplished a whole lot.
Yeah. 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 Dr. Jennifer Franklin, thank you so much for being with us. This has truly been a pleasure. And for everybody listening, this has been Mind Body Medicine for Chronic Pain, and I will talk to you next week.